Welcome to Integrative Medicine Perspective. I'm Dr. Wendy Liu. Last week, I gave a talk about type 2 diabetes in an Asian American social center. The audience was very responsive and gave me great questions. So I'm going to share the content of my talk and some of the questions. As a physician, I always feel a little bit embarrassed to talk about type 2 diabetes. Why? Because there has been so much improvement in our knowledge about type 2 diabetes and its treatment options. So theoretically, with better knowledge about prevention and screening and with more treatment options, we should have better diabetes numbers. But the reality is that the diabetes rate is still trending up, most recently, even at a faster pace. Type 2 diabetes is really a global health burden. This recent JAMA article reported diabetes statistics in China. The Chinese diabetes rate was 12.4% in 2018. The pre-diabetes rate was 38.1%. So in other words, more than half of the population were either diabetic or candidates for diabetes. Now, 1 out of 4 people with diabetes in the world is Chinese. The most worrisome diabetes statistics in China is its high rate among young people. Why China has such a high rate of type 2 diabetes? Is it due to genetic causes? But the Chinese diabetes rate was less than 1% in the 1980s. So the most recent explosion of diabetes rate over the past 40 years is most likely not due to genetic causes. A more Western lifestyle shift and an increasing obesity rate in China were most likely the reason. The current Chinese diabetes rate is lower than that of America. America has the highest healthcare spending in diabetes in the world, with China being the second, spending much less than half of that of America. After my talk, there was question about early stage symptoms for type 2 diabetes. I think that question hit the key for early detection and early intervention for type 2 diabetes. If we know the early symptoms of type 2 diabetes, we can take actions to deter its further development, which can cause various complications. But unfortunately, symptoms at the early stage of type 2 diabetes are very subtle or non-exist. The lack of symptoms is one of the biggest challenges in early detection and early intervention for diabetes. A yearly doctor's visit can be helpful, but not as timely, as ideal as possible. Why are there not early symptoms for type 2 diabetes? Let's take a look at its risk factors: genetic causes, age, obesity, lifestyle, including diet and lack of physical activities. Except for genetic causes, all of the other risk factors take a fairly long period of time to reach a certain level that can cause diabetes. We don't age in one day. We won't become overweight or obese in one day. Just a few unhealthy meals will not make us diabetic. Skipping 1 or 2 days of exercises will not make us lose muscle mass permanently. So the development of diabetes is quite stealth. By the time symptoms are developed, diabetic complications have most likely already happened. For instance, when a person sees an eye doctor for visual disturbances, when the eye doctor finds diabetic retinopathy, meaning diabetic damages to the retina, the eye ground, this person have already had uncontrolled diabetes for years. So how do we prevent a disease without early symptoms? We need to understand a little bit of the action of elevated blood sugars. Imagine you have a glass of pure water and a glass of sugar water. the sugar water is more viscous, isn't it? The higher the sugar concentration, the higher the viscosity of the water. The higher the viscosity of the water, the slower it pours out. High blood sugar levels have a very similar effect on blood viscosity, but the action is not limited to that. High blood sugar levels can also cause high blood fat levels and make the blood even more viscous. But the strongest effect of high blood sugar levels on blood viscosity is due to their effects on the red blood cells. High blood sugar levels can make the red blood cells more rigid and less likely to change shape. When the red blood cells flow through the microvasculature, the very small blood vessel bed, the rigidity of red blood cells make them not easy to flow through. The diameter of a red blood cell is usually the same as or even bigger than the internal diameter of a very small blood vessel. When the red blood cells flow through those small blood vessels, they change to a long oval shape to flow through. But if they are rigid and not able to change shape, along with a high blood viscosity, the blood flow in the microvasculature will be very slow. When the blood flow is very slow, tissue nourishment and the removal of tissue metabolic waste will be very inefficient. That's why microvasculature, the very small blood vessel bed, is usually the first and most affected in diabetes. Now we know the action of high blood sugar levels. What can we do to prevent them? We can approach this concern from mainly two aspects: sugar in and sugar out. Sugar in is very easy to understand. We need to control the intake of pure sugar and refined carbohydrates. But here I wanted to emphasize that we should not restrict significantly our intake of complex carbohydrates because we depend on them for certain vitamins, minerals, and fiber, which are very, very important to our metabolism. So what is sugar out? That is our body's disposal of sugar. Our body mostly uses sugar for energy to support physiological functions. For instance, thinking, moving. Every single physiological function needs energy. The second action is to store sugar as glycogen in the liver and muscle. And the rest of excess sugar will be turned into and stored as fat. So in order for us to maintain or even improve our body's ability to handle sugar, we needed to protect our liver and maintain or even increase muscle mass. That means, one, to avoid lifestyle habits that can lead to fatty liver, such as alcohol drinking, high sugar, high fat diet. And two, to perform resistance exercises to improve muscle mass. So to improve our body's ability to store glycogen, store sugar. When sugar intake, expenditure, and storage are balanced, high blood sugar levels are unlikely to happen. That's all about the discussion of type 2 diabetes today. I'm sure I'm going to have more topics to talk about on type 2 diabetes and insulin resistance in the future. The development of type 2 diabetes is certainly much more complex than what I have covered today. But I hope this video is helpful in understanding the actions of elevated blood sugars on the development of diabetes pathologies and the things we can do in our daily life to help prevent high blood sugars. I hope to see your comments and questions, and I will see you soon.